We are talking today about high-yield case for the USMLE Step 1, Step 2, and Step 3 exam. And our case is about 22-year-old athlete who reports fatigue, but he can run 5K marathon. And we got our catheterization data here. Right ventricle oxygen saturation is 74% versus in the right atrium saturation of 57%. There is a step up of oxygen saturation between the right atrium and the right ventricle, and the left ventricle and the aorta saturation is normal, 99 and 98%, and the ECG shows right bundle branch block. And the question here asks about what exam finding would you expect in this patient? And our first option is a pulse delay. It's a wrong answer. It refers to coarctation of the aorta, which does not include any step up or down of oxygen saturation in the heart. Second option is continuous murmur. This is the murmur of the beta and ductus arteriosus. It includes a step up of oxygen saturation, but between the pulmonary artery and the right ventricle. And the third answer, which is the correct answer, is the holosystolic murmur, the murmur of the VSD, which include a shunt between the left ventricle and the right ventricle, and there is a step that causes a step up of oxygen saturation between the right ventricle and the right atrium. And answer D is also wrong. Fixed SO2 split refers to the murmur of the ASD, which causes a step up of oxygen saturation between the right atrium and the inferior and superior vena cava. So first, there are three possibilities here. First, there is a step up of oxygen saturation between either the superior and inferior vena cava and the right atrium, and the cause here is AST, atrial septal defect. The blood goes from the left atrium to the right atrium, and this causes this step up of oxygen saturation, and this is causes fixed S2 split. This is the first scenario. Second scenario, as in our case here, there is a step up of oxygen saturation between the right ventricle and the right atrium, and this is due to VSD. That causes blood going from the left ventricle to the right ventricle. Third possibility is step up of oxygen saturation between the pulmonary artery and the right ventricle, and this is due to mainly due to beta and ductus arteriosus. Beta and ductus arteriosus abnormal connection between the aorta and the pulmonary artery here, and the oxygenated blood goes from the aorta to the pulmonary artery and causes this step up of oxygen saturation. So this is for our options. The pulse delay refers to coarctation of the aorta. Again, no step up of oxygen saturation. Continuous murmur is the murmur of beta and ductus arteriosus. It causes a step up of oxygen saturation between the pulmonary artery and the right ventricle. Third option, which is the correct option, holosystolic murmur, the murmur of the VSD, shunt between the left ventricle, the right ventricle, step up of oxygen saturation between the right ventricle and the right atrium. Our final option, which is also wrong, fixed S2 split, which aka murmur of ASD. This causes build up or step up of oxygen saturation between the superior and inferior vena cava and the right atrium. And I hope you guys enjoyed it.